Here in the Mid-State, we have the beautiful rolling hills and all the great trees and flowers, and with it comes a lot of pollen. And if you're somebody who suffers from allergies, then you want to listen to this segment. We're going to be talking specifically about children and allergies. And joining me to do so is Dr. Hillary Hunt. She is with Tennessee Medicine and Pediatricians, based out of Smyrna. And thanks so much for being with us on the program.
I'm glad to be here.
So many kids pick up things, Dr. Hunt, from time to time. When I say things in terms of germs, and we always see when that common cold starts, or we see them sniffling or pulling on their ears and things like that. When do we know if it's allergies instead of, say, a common cold?
It can actually be a little confusing because a lot of the symptoms will overlap. So they may have a runny nose, nasal congestion, stuffiness, fatigue, maybe even a little bit of cough with either allergies or colds. But the hallmark for allergies is itching, which is not something you primarily see with colds. So the itchy nose, itchy ears and throat. Also, the nasal discharge from allergies is typically very clear and watery, and it may be more colored, yellowish or greenish with a cold. And you won't have a fever with allergies.
Okay, what do you usually tell parents in terms of trying to keep the little ones comfortable when they start having these symptoms?
It can be difficult for the very young ones. With severe symptoms under the age of 1, occasionally pediatricians will allow your child to have an antihistamine, but it's typically not recommended by the American Academy of Pediatrics because of side effects. So more importantly would be allergen avoidance, which I can explain more.
Please, yeah, if you don't mind, absolutely.
Depending on the type of allergy, obviously food allergies are sort of their own category, and avoiding those allergies involves knowing what you're allergic to and reading labels, asking questions where your children will be served food. But the allergies we most deal with are the seasonal allergies, the hay fever type symptoms.
Sure.
And so allergen avoidance can include taking a bath and a shower after you've been outside before bed to get the allergens off of the body.
That makes sense, sure.
Using allergen covers for pillows and mattresses where dust mites love to congregate. Getting rid of carpets or drapes, also big players for dust mites. Avoiding pets if your child has a pet allergy, or at the very least keeping the pets out of the bedroom. And using a mask for dusting or vacuuming or mowing or other times when you'll be exposed to a large amount of an allergen. And frequent dusting and vacuuming is helpful.
Can allergies ever turn into something else? In other words, you know, like you were saying, some of the fluid or the drainage that you see is clear, but does it ever become infected? And at what point does that happen?
Absolutely. Allergies actually can increase your risk for infections. Mucus is a great place for bacteria to grow. And the inflammation from allergies not only increases mucus production, but it can also block the normal movement of mucus and increase the risk for ear and sinus infections. So typically what you'll see is if you've been going along having this watery drainage, watery eyes, but then start to get a little worse, maybe the drainage is changing colors, or maybe now you're getting a fever, or you thought things were going along just the same and there's a change, that's when you'd be evaluated for something else.
Okay, can that happen at any age regardless, or does that happen once a child starts getting a little bit older?
It can happen at any age.
Okay, so even when they're really tiny, they can get that ear infection from the mucus being infected.
In fact, they might be more likely because every passage in the body is much smaller, so they're more likely to block the passage.
Okay, let's go back to food allergies, if you don't mind, Dr. Hunt. This is something that I would think a lot of parents would feel as if my child had, let's say, peanut or eggs or milk, a lot of the things that children become allergic to or are allergic to. They would have a reaction right away. Is that the case?
Most food reactions will occur within minutes to an hour or so. They may develop hives, nausea, vomiting, diarrhea. The most severe reactions involve the airway swelling, and that's when we become really alarmed.
Sure. What is the first step of action, I guess I should ask, as far as what a parent should do?
If there is airway involvement, so if there is any swelling or tightness of the lips, tongue, face, throat, any trouble breathing, or even faintness, paleness, or passing out, then absolutely the caregiver should call 911. And hopefully, if there's epinephrine available, if they have a known allergy, they will have an EpiPen and be able to use that.
Okay. And that's something that obviously you'll consult with your doctor once the child has been seen, and you know, you
Right.
talk about what the options are as far as this needs to happen. This is the next step.
Absolutely.
Okay. Going back now to all allergies, when we're talking specifically about you know, kiddos being treated, is this something that you all classify as chronic when it's year after year, the same time, maybe becomes a little bit worse? At what point do you take another step in treating allergies?
That's a great question. Some children will have relatively minor symptoms every fall or every
Sure.
spring. They can take an over-the-counter antihistamine, get through the season, and they just repeat the next year, no big deal. But if a child is having significant symptoms that aren't adequately treated with allergen avoidance and antihistamines, then they would be a good candidate for allergy testing.
Okay. And what's involved in the testing? Because that's one thing that a lot of folks probably don't know if you've never been to your doctor to get that testing done.
Right.
What is the process?
So the most common type of allergy testing is known as skin prick testing. And it involves placing a small amount of the allergen on the skin
Okay.
and then scratching or pricking the skin with a needle. It's actually pretty painless. There's not a lot of nerve endings in that part of the skin. And you wait for 20 minutes or so to see a red itchy bump arise. If that doesn't produce a reaction, oftentimes they'll go a little further with an intradermal injection, which is the same process, it's just right underneath the skin. Also really minimally painful at all. And that's the most accurate and the quickest way to get results because you see immediately what you're allergic to and can discuss it from there. There are a couple of other allergy testing processes. One would be patch testing for things that may cause rashes. So you put the allergen on the skin, cover it with a bandage for 48 hours and see if a rash occurs. And then there are also blood tests that can be done if someone has, say, a skin condition or another reason they can't have the skin testing. And it involves putting the allergen in a blood sample and looking for antibodies. It's not preferred because you can have antibodies even though maybe the child would not actually have significant symptoms. So the skin testing is preferred.
Okay. Gosh, that's great to know that there are so many options and things that the pediatrician can do to help, you know, kind of calm down these allergies.
Right.
One last thing, do kids outgrow allergies over time?
Children can outgrow food allergies, but unfortunately they typically do not outgrow seasonal allergies. However, because when you're young, like I said, all the passages are smaller and easier to occlude, and you may have a little bit more significant symptoms as a small child, so you're going to notice the stuffiness in a tiny nose as opposed to a larger nose. So the symptoms may not seem as severe, but typically we don't outgrow them.
Yeah. Too bad, huh?
I know.
I'm sure a lot of parents would want to hear
miserable.
something else. And for those parents whose kids are experiencing asthma or asthmatic type coughs, because there's a difference,
Right.
what should they do?
Well, asthma can be triggered by allergies, but also be triggered by other things. And if your child is having a frequent cough, then certainly they should be evaluated by their physician for asthma, because asthma that's left uncontrolled causes problems, long-term damage to the lungs, and increasing risk for infections for similar reasons that allergies do. So if you are concerned about asthma, certainly make sure your child is evaluated for that.
Yeah, I wanted to get that in there because a lot of parents, you know, get concerned about that as well.
Absolutely.
All right, Dr. Hillary Hunt, thank you so much for your time today.
Thank
It was
you.
great visiting with you.
Thank you very much.